And then we'll go over a bit of the background of the RFA, the Alliance's work with SBIRT, and then we'll open it up for questions. So the bulk of the webinar will just be Q&A time, hopefully answering any questions that anyone has about this opportunity. We do want to give a special thanks to the Hilton Foundation for funding our work. And now I'm going to do the brief overview of the Alliance's SBIRT work. So we've spent the past 5 years working in this area, adapting SBIRT for school-based health centers specifically. We've just issued our last project's implementation brief. So our overview of our last several years of work is available on our webpage, sort of going through the sites we worked with, our findings, and the different ways that we're implementing SBIRT in school-based health centers. I'm assuming that most people have already looked at the request for applications, but it is available online. And again, we will record this webinar and have the slides available for you to access it. The RFA is on our webpage, and basically what we'll do today is go through the RFA and then again offer time for questions. So kicking that off, the purpose of the funding is to, again, support school-based health centers across the country in preventing, identifying, and reducing substance use and depression in middle and high school aged youth. Our model is sort of an expanded SBIRT where we're also looking at, including depression screening as well as substance use, and engaging youth in healthcare, both to support their engagement in their own healthcare and to support the implementation of the SBIRT model in terms of efficacy, getting some youth voice involved. And we're also looking at using our model to work with schools to promote restorative justice and alternatives to discipline. And so more on that later. We're looking to fund 8 to 10 sponsor organizations and their affiliated school-based health centers for 1 year of a learning collaborative. And that will be, the number of school-based health centers is negotiable, so to speak, but we want to be thoughtful in looking at scale, so we can answer questions about that as well. Benefits of participating are that, we're going to look at SBIRT, but also just improving implementation of SBH services, integration in the school, those sorts of things generally through a self-assessment process, as well as implementing SBIRT. So you get the Alliance's expertise in school-based health center implementation and SBIRT training and implementation for your sites. We have a national group of expert faculty that will support our work. And we're going to use some, trying out some new technology that I think could be really effective. The Norcognito interactive role play simulation training that lets providers practice doing brief interventions with an avatar, and also includes some CEUs for providers. We'll also be using Zoom, this platform that we're currently using to do learning collaborative meetings and other webinars, as well as Basecamp to do project sharing and resources and communication. Sites will also receive the Teen Intervene curriculum, which is a $400 manualized short treatment or brief intervention curriculum, as well as we are incentivizing the project with a subgrant of $5,000 per sponsoring organization for participation. But a bit of that will have to be used to send at least one representative to our national convening. Next up, who should apply? So we're looking for applications from sponsoring agencies of at least 2 school-based health centers, providing and billing for both primary care and behavioral health services. So you need to have integrated behavioral health in a middle or high school setting at least 20 hours a week. You have to have an EHR and clear partnerships with a behavioral health agency if it's different than your primary care sponsoring agency. Sometimes those are partnerships, including an MOU. Same thing with the school district, a clear partnership with an MOU. And you have to have access to technical support for data entry, reporting capacity, and EHR modification. So that's really important. You've got to have some good in-house IT support for your EHR to be able to make some of the changes we'll need to report the data. And you also have to be a member of the Alliance, and there'll be some more information on that at the end of the presentation. So priority will be given to agencies, sponsoring agencies that have demonstrated experience collaborating with the school and community partners. So if you could show sort of a strong foundation of school community partnership, as well as if you've already got a strong youth engagement, youth advisory council program. And it's especially valuable if your school or district is open to offering restorative justice or alternatives to discipline programs. So not that we're going to go tell them they have to do it, but that it's collaborative and they're already maybe open to those opportunities. So we'll go through the expectations and timelines. Applications are due August 15th. And there are, I think the larger part of the application is those signed assurance pages. So be sure to check that out in the RFA. If selected in September, we'll be forming sponsor change teams. So we're really just looking at the key people who would be needed for SBIRT implementation. So your sponsor change team would be, your primary care director, manager, lead provider, somebody that has a leadership role. Same thing for a behavioral health position. And ideally an IT representative. They may not need to participate in every call, but you would really need them on board for any modifications and reporting. And then we'll have a welcome webinar that the sponsor change team will need to attend. There's a self-assessment document that will need to be completed to look at how your SBHC works and look at how you're implementing both behavioral health and SBIRT. And then we'll work on action plans based on that self-assessment. And then in October through December is when we'll use the Project ECHO model to do sort of a peer learning with expert faculty training. So each session of ECHO includes didactic presentations by our expert faculty on different SBIRT topics to support implementation, as well as each sponsoring agency's sponsor change team will use their self-assessment and action plan to present sort of a case study on their current status of implementation and needs, and get feedback from other sites. So it's a real give and take. It's not a webinar. I want to be really clear about that this should be a very interactive process. And then sponsor change teams will then take the learning from ECHO back to their sites and providers to support their implementation. And then independently of that, sponsor change teams and their primary care and behavioral health providers will complete the training using the Norcognito software, kind of at their own pace. January to June, we will hopefully have implementation in place and be able to, you guys will be able to collect and send data in, and then we will be able to kind of report back on how that goes through that 6-month period. We also may look at, we'd like to get some outcome data. So we may look at client pre-post surveys with sites that are willing and able to get consent to measure outcomes. That's an optional activity. And then through January to June, we'll present more webinars and or ECHO model trainings, depending on what makes sense, driven by need for our sites. So monthly meetings, trainings to support implementation based on site need. And then we'll wrap it up in June 2020, and at least one sponsor change team member will attend the SBIRT-in-SBHCs Learning Collaborative meeting and kind of end of work celebration at our 2020 National School-Based Healthcare Convention in Denver, Colorado. So again, the due date for these applications is August 15th, and then we will notify the selected applicants by August 31st. A couple final thoughts I just wanted to put out there. Again, this round of implementation, a bit different from our prior SBIRT implementation, we are going to focus on some foundational school-based health center functioning, partnership, collaboration type things to start with, because we've found that SBIRT implementation is much more successful if we've kind of gone back and looked at some of the foundational school-based health center stuff, hence the self-assessment that sites will complete early on and drive their action plans with. I think it's important to be realistic. I think that if you don't, for example, if you don't already have a strong partnership with your school and they're not open to something like alternatives to discipline, we may not get there in a year. So just being realistic about, we have a lot of different aims with this work and we want to support this work, but what we may, if you don't have that strong partnership with your school, maybe we'll work on that partnership versus jumping right into trying to get them to do alternatives to discipline if they're not ready for that. So just thinking about that, again, just want to reiterate the need for on-site integrated behavioral health within the school-based health center. We want to often treatment options for youth are limited, and we want to be able to provide some on-site treatment that's developmentally appropriate and tailored to the students. So we definitely need that piece of it. And then we'll also be using a lot of technology between Project Echo and Zoom and Basecamp and lots of video meetings. It's important that that you have access to appropriate technology, that you have computers with video cameras that you can use. Especially during Project Echo, that's very peer consult oriented. The Echo founder calls it all teach, all learn. It's not a passive webinar attendance. It's very engaged. You're expected to present and offer feedback to peers in the project. So just really want to put that out there in advance, that it's a very interactive platform. So that's all I have. I will turn it back to Ufoma for our next piece.
Thank you, Katie and Samira. Now is the time to enter your questions into the chat box in your Zoom control window. While you are entering your questions, we have a few announcements we would like to share with you. Please join us and become a member. Our members extend and support our work, as well as receive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit www.sbhforall.org/membership for more information and to join. Now, we will begin the question and answer session. Our first question is, do we need a separate MOU with our schools if we already have one for the SBHC on site? And can the SBIRT be implemented by health educators, or does it need to be a PCP?
Great question. This is Katie. So if your school-based health center has an MOU with the school, that's what we mean, that you would just need to be sure that agreement is in place. So hopefully that answers that question. It wouldn't be like a new MOU for SBIRT. It would just be that existing MOU for your school-based health center. And then in terms of SBIRT being implemented by a health educator, there are pieces that health educators can do. And I think we could get into the nuances of that, but there's, different chunks of SBIRT, so screening, brief intervention, referral to treatment, and there are chunks that perhaps a health educator could do. For instance, a health educator could potentially do the screening, and then the follow-up brief intervention might be done by a PCP. The health educator what we've typically seen health educators involved in the most is more of like the youth engagement, youth advisory council, supporting some of that work. There's also referral to treatment. What we're advocating for is that, the primary care provider would review the screening and do the brief intervention, and then the referral to treatment would be done by a behavioral health provider. Our model is using Teen Intervene to kind of frame that treatment, but Teen Intervene can be provided, per the manual. It can be provided by a variety of youth serving personnel. So it's up for discussion, but you would definitely need to have PCP and behavioral health involved at different stages. So again, we could take that on a case-by-case basis, but if you don't have PCP and behavioral health, it would be hard to do the entire implementation.
Can on-site mental health services be provided via telehealth?
Yeah, so I think that we could look at that. We haven't done that specifically with our SBIRT projects yet. My background is in behavioral health and a lot of telehealth work, so I could certainly see how, again, as with any telehealth work, that with a little creativity and appropriate technology, we could make that work. I think I would articulate that in your application, though, how you plan to do it.
Is there a certain number of SBHCs within our sponsored network that we should propose? We currently have 13 SBHCs trained in SBIRT. We would propose this collaborative for enhanced learning and service at a few of these SBHCs.
Yeah, so I think that would be great. And again, in terms of the number of SBHCs that you would want to include in the project, I would look at your internal capacity, because again, we will largely train the sponsor change team and make some trainings available to all your providers at your different SBHCs or those sorts of things. But the bulk of the work will be that sponsor change team. So whoever is leading the project will attend ECHO and be doing the self-assessment and the action plan and gathering the learning from those sessions and taking it back to the sites to train them. So in terms of scale and scope, I would really think about what's your capacity to train those sites. So if you have 13 sites that are already trained and it seems like a good idea to implement it at a few of those, join our collaborative to support enhanced learning with a few of those sites, I think that would be great. I think certainly we're always experiencing turnover in providers, so it's great to get new staff trained. I also think that you can never have enough training in things like brief intervention and motivational interviewing and those sorts of things. So I think revisiting it is a great idea.
Can you talk a little bit more about the financial sub-grant incentive and the evaluation piece?
So it would help to know exactly what you'd like to know about the sub-grant, if you could maybe clarify. Again, it would be $5,000 to support your implementation, so no real strings attached there aside from it supporting SBIRT implementation, with the one caveat that you would need to send someone to the convention in 2020 with part of that money. And then the evaluation piece, Samir, do you mind sharing? We had kind of a brief overview of that. Is that something you could speak to real quick? Oh, Samira might not have sound. Oh, her internet went out. So basically, the evaluation piece, what we would look at collecting is some basic data around numbers screened, numbers provided, brief intervention, numbers referred to treatment. And then, like I said, we would like to start getting into outcome measures. So maybe some pre-post survey, for sites that are ready for that, maybe looking at some pre-post surveys and that sort of thing. I don't know if that answered your question. Feel free to resend a question if you need more information.
Does the medical director need to be an MD or a DO, or can it be led by a nurse practitioner?
Your sort of lead person at your site can be a variety. So if you have like 12 school-based health centers and there's a school-based health center program supervisor, that might be a good person. If you, if you're a provider that's really interested in doing this work and getting, you have your leadership on board and have the capacity to do that and support your other sites, I think it could be a provider. So it does not need to be an MD or DO. It can be anybody who's sort of in that leadership role at your school-based health centers, if that makes sense.
Can you review again the $400 versus the $5,000 to sponsors, and what is the reimbursement rate for SBIRT screening and for treatment through Medicaid?
So the $400 is, I was just sharing that as the price of Teen Intervene were you to go buy it. So we're providing the Teen Intervene curriculum to you for free. It would normally cost $400 were you to buy it. The $5,000, again, is $5,000 to the sponsoring agency to support implementation, with the one restriction that you would need to use some of that money to send someone to the 2020 convention in Denver. And there's more, that's all listed in the RFA. The reimbursement rate for SBIRT through Medicaid, I do not know that off the top of my head, but it's definitely available online. Feel free to send me a follow-up email and I can send you links to that.
We are a telehealth alliance organization. We partner with schools and provider organizations to form our school-based telehealth centers in our schools. We have MOUs with our schools and partner provider organizations. Are we eligible to apply?
I would definitely love to look at your application and see how you would make that work. Again, I would love to know how it would function in a school. So maybe some details about if all of your providers are entering the school via the telehealth model, who is on site to support that? What are the logistics looking like? Those sorts of things. But yeah, I think as long as you meet all those requirements with, the MOUs and having primary care and behavioral health, I would love to hear how you would make that happen.
Can you touch more on restorative justice, alternatives to discipline programs? What do they entail?
So restorative justice and alternative to discipline with the, specifically to the work we're doing, is just this idea that schools have often had punitive practices around discipline for substance use offenses. So zero tolerance, automatic suspensions, expulsions. And what we would like to support is schools looking more at a restorative justice framework where, instead of just a zero tolerance, one strike and you're out policy, that we support them in using the resources of the School-Based Health Center, and specifically the SBIRT capabilities, to refer students for treatment versus just kicking them out of school. And again, I can get more information to folks interested in that. If you email me after the session, I can send you links on some of how that works.
Does the mental health provider in the SBHC need to be available for webinars, echoes? Also, do they need to complete the online simulated trainings?
Yeah, so again, the sponsor change team, you would want to have a primary care representative, or either your school-based health center manager for all your SBHCs, and or a primary care lead, you want to have primary care and behavioral health represented. So maybe if you have 12 SBHCs, maybe it's one mental health provider who does, attends the Project Echo trainings early on and helps with the self-assessment and does some of that early work. And then the webinars that we'll do later on will be open to all providers. And we will expect all providers to do the online simulated training. I think it's a good review for everyone.
Can the 20 hours clinic time in the schools be a combination of medical and behavioral health services?
I think that would be okay. Again, I would detail how that looks and how you would plan to implement SBIRT. Say if the primary care provider is doing the screening and the brief intervention and doing a warm handoff to behavioral health, what does that look like in your center, and how will you ensure that all needs are met, essentially? All right. Are there any more questions? Feel free to type them in, and we'll.
Okay. Is it travel required for lead providers for training, or are they online to bring back to care teams?
Travel required. Are you talking about for ECHO or for the convention? The only travel would be for convention. Everything else is virtual. So Project ECHO is virtual. And then when I said bring back to the other sites, it's more the information you would want to share back with your provider teams and your school-based health center sites. So you would sort of be the gatekeeper, collecting all the information for implementation and taking it back to your sites and training them. But it's all the training will be virtual.
How often is the sponsor submitting the data to the Alliance? Is it monthly?
I believe for those 6 months from January to June that we would want it monthly. Samir, did you have something else in mind?
Yeah, I'm sorry, I had a really bad internet connection, but I'm back. We're hoping for monthly data. And again, I don't know if you covered this, but de-identified data. So hopefully the data pulse will be pretty easy to run on, like the total number of clients screened, things like that.
Oh, perfect. Thanks, Samira. Any other questions? We'll give people a couple more seconds. Last questions. If you aren't able to get your questions entered now, or you think of something later, feel free to contact me. My email is up on the screen. It looks like there's one more.
You mentioned that it's de-identified data. So is it only aggregate, or does IT need to be involved?
We are hoping for, so I think that the short answer is yes, IT likely needs to be involved just to make sure that the fields that we're collecting data on are built into your system. So again, we would want to know things like the number of clients screened each month for substance use or depression, and then what happens with those screenings. Were they positive, and then did they receive a referral, and or did they receive school-based behavioral health services? The data can be reported in the aggregate. So if you have reports that are built to run those type of data, then we don't need significant IT involvement. But if you don't have those reports readily available, I think it would be very important to make sure that your IT team is working in partnership with the SBHC to make sure that those data can be pulled out of EHR or whatever data system you're using.
Can we look up more on Teen Intervene?
Yeah, you're welcome to research Teen Intervene.
Is Teen Intervene curriculum a behavioral intervention?
Yeah, so if you Google, it's sold by Hazelden, and you're welcome to do some more research. It is an evidence-based sort of expanded brief intervention. So in our school-based health center work, we've been using it as a referral to treatment option for sort of lower level use. So depending on your screening results, if it's early use or, not significant, something requiring really significant outpatient treatment or inpatient treatment, medically monitored treatment, Teen Intervene is not a fit for. But so this would be an intervention that you can provide in the school setting for early use. So I would definitely, you're welcome to just Google Teen Intervene. It's sold by Hazelden. You can get some information that way. You're welcome to, again, email me for more information about it, and I can direct you. We also, we do have the developer of Teen Intervene, Ken Winters, is a regular consultant, and will be available for technical assistance with that during our implementation. Any other questions? We'll give it just a second. Like I said, feel free to email me with any other questions. I'm not seeing any new questions, so I'm going to go ahead and thank everyone for participating today. We're very excited for this opportunity. Again, please contact me if you have further questions, and we look forward to seeing your applications. Thanks, everyone.